Welcome to the Veteran Action Update Brief. I'm Mark Lucas, the founder of Veteran Action. Our guest is Tom Sauer. Tom served in the military as a rifleman in the Marine Corps, as a Navy EOD officer, and he's a proud graduate of the Naval Academy. After his military service, he founded Miramar Health to help veterans who are suffering from mental health issues and also from addiction. Tom, can you tell us about the inspiration behind you launching Miramar Health?
Sure thing, and thanks for having me, Mark. I was inspired to get involved in this. It went back to my childhood, to be honest. My father struggled with mental health and addiction problems his entire life. And in fact, about 5 days before I graduated from high school and about 3 weeks before I left for Marine Corps boot camp, when I was 18 years old, he died of a meth overdose. So that was something that really stuck with me for a long time. And then after my career throughout the military, especially through 20 plus years of the war on terrorism, I can say unequivocally that I've lost far more friends to addiction and suicide than I have to ISIS, Al Qaeda, and the Taliban combined. And you ask anyone who's been in the military for more than a minute, they'll tell you the same.
And Tom, can you share your experience as a community care provider in dealing with the VA?
Sure. I started the company with my classmate from the Naval Academy, and we obtained what's called a community care network contract, which is created through President Trump's first term, the VA Mission Act. And that was intended to create veteran choice and to give veterans options for their own choice, or also in the event that the VA cannot, or due to wait lists or wait times or capabilities, either cannot or will not treat the veteran within their own facilities. It created choice and expanded options for veterans. So that's what our community care contract is focused on mental health and substance abuse treatment. And we're currently in Southern California. We've worked with more than a dozen VAs throughout the Western United States. We've got really good relationships on the boots on the ground level, and we've treated nearly 1,000 veterans. And when I say 1,000 veterans, that doesn't mean we just touch them or at a counseling session. The veterans who come to us are rock bottom. I mean, these guys are at the end of their rope. They've usually lost or been cut off from their families. They are facing death or incarceration at best. And we are there, almost think of us as like a trauma center from the standpoint of mental health and addiction treatment. So we are there to treat the most vulnerable veterans in the United States.
And Tom, can you share a personal story about a veteran who was failed by the VA?
Absolutely. I mean, there are many such cases, but one in particular that stands out to us that we've even shared with Congress was about a man from Los Angeles named Luis Tafoya. He was actually about our age. And he was a Marine infantryman who then later became a school teacher in Los Angeles, had struggled with depression and alcoholism, throughout most of his adult life. And he was struggling, is affecting his work. He went through the VA, came to us at Miramar, had a really successful run. He was with us for two months or so through inpatient and outpatient treatment. And he did really well. And then after we discharged him, he was still seeking some treatment. But as in many such cases, when dealing with addiction, mental health issues, he relapsed. And that's common, right? That happens. It usually doesn't take one shot to fix this kind of a problem. So when he had relapsed and he was struggling, he was really in a bad place, he wanted to come back to us. So he reached back out to the VA in Los Angeles and said, I would like to come back to Miramar, like you had done with me before, refer me to Miramar. Well, the VA said, well, no, we're not going to do that. And we might have a spot at their in-house domiciliary in West Los Angeles. And he refused to go there just due to conditions that are there, in his words, the conditions that were there. And he had a very good experience with us. And many such cases for other community care providers. I'm not just talking about my company. There are plenty of others out there that do a fine job. And so after he was denied, this man, Luis Tafoya, had a little bit of agency, and he did his homework and he looked up the Mission Act. He looked up regulations, and he came back to them saying, this is wrong. Like, you're supposed to be able to grant me this choice. So he filed a complaint with the Veteran Experience Office. It took 10 days for them to get back to him. And they came back and said, no, we're not going to do that. And we had all that in writing. And it wasn't until very late in the game that we even found out about it. And once we found out about it, we actually reached out to him and to his wife saying, hey, we understand you're not able to get the referral. We don't care. Come on in anyways. We do it as a gift or on scholarship. We just want to make sure, we want to make sure you're better. And we've done that many dozens and dozens of times for veterans, taking them on scholarship. Unfortunately and sadly, when we were reaching out to him, I think it was the following day. This was last summer, summer of 2024. His wife found him dead in the bathtub. So that was really awful, and so that was a real kick in the gut to a lot of our team. And that was, and look, that is not an isolated incident. And many cases of veterans who are either delayed care, because delayed care is denied care. And when they're being told to put on a waiting list, when there's a community care bed available immediately, when the VA says, no, we know you're in treatment, you want to come into treatment, but we can't put you anywhere right away. We can put you on maybe a few weeks, up to 30 plus days. And that waiting list wait time is very nebulous. And then, what that veteran really hears is, we can't help you. And then almost always, they relapse, and quite often they die. And I think that was exceptionally unfortunate. And there are many, many cases, but a lot of those just simply aren't documented. They're really hard to track. So that was something that was a real hard spot for all of us. Yeah.
And Tom, under President Trump, there were historic reforms that were passed the VA. He passed the VA Accountability Act. He passed the Mission Act. But after Joe Biden came into office, there was this brewing controversy. It sounds like there may be a very big scandal that could eclipse the Phoenix VA scandal. As a community care provider, it sounds like there are people that are denying access to care, these career VA bureaucrats. Can you tell us about your experience on the ground?
Absolutely. So when the VA Mission Act was very slow to roll out, because there are many careers within the VA that look at community care as a threat. The analogy you could think of it is between public education and charter schools. And because, the public option looks at the private options, who provide, arguably, you could say, some might say, better, higher quality care, but they definitely do it for a fraction of the cost. A community care provider costs less than half of what it costs the VA to treat a veteran in-house. Many such cases. This is not that controversial, and people know it. But the thing is, though, is that the VA is somewhat allergic to community care and doesn't like to refer out when they can, especially when you think of the most important aspects of veteran healthcare. The most critical ones for veterans these days is not their dermatology, it's not orthopedics, it's suicide prevention, mental health, addiction treatment. Those are the biggest ones right there. And when the VA facilities are usually too full, cannot or will not, they should provide an option to community care. When there have been cases where we've told the VA, we can take this veteran that they're putting on a waiting list, so we can have them in our care by lunch, right? We really can. And they said, no, we can't do a referral. And it's gotten so much worse now, worse than the Phoenix VA scandal, which, just for background, about a decade ago, there were dozens of veterans that died due to being put on waiting lists, cancer screenings and biopsies that were tested as malignant. They neglected to tell the veteran, and tons of these veterans died. I'm thinking the scale of this is much, much higher. And this is because there are careers within the VA who are slow rolling and subverting the legacy of President Trump through the Mission Act during his first term and today, and also are threatening to dishonor the legacy of Secretary Doug Collins, who is obviously very committed to fixing reforms. And a huge problem of this, where this comes from, is as of today, we're looking at 9-10 months into the second Trump administration. Secretary Collins has been in the seat for 8 months, thereabouts. And to this day, there are currently no political appointees within the Veterans Healthcare Administration, which, keep in mind, that is by far the largest section of VA. It's where probably 85-90% of the dollars and people within the VA work in healthcare. And there's currently no undersecretary for health. There's an acting right now who, from what I'm told, is not a friend of community care. So right now, you've got all the careers running the show who are subverting and probably lying to Secretary Collins' office, and therefore, by extension, to the president, defying his executive orders and defying the guidance of the secretary. And, VA central office and everyone in DC, because I go there a lot. I was at the White House just last week and meeting with folks within Domestic Policy Council who know a thing or two about this, telling them the problem. And right now, it's just what DC is being told is 180 degrees out from what's actually happening in the field right now. And this is mostly due to, I don't know of a better term, bureaucratic administrative state careers within VA who they have openly defied, many times in writing. We have it in writing from California VA saying, no, this is how we do things. No, they still need to go through an administrative hurdle instead of in order to get a referral, as opposed to if the primary care provider assigns a referral to community care to someone like us, it must be approved. I've seen California VA hospitals just in writing openly just defying the secretary and defying the president.
And Tom, your stories about veterans failing to receive care just proves why it's so important for us to pass the Veterans Access Act. We mentioned earlier about all those historic reforms that President Trump passed in his first term. Well, the Veterans Access Act will help codify those access standards, will help protect those wins for veterans. And that's why we are encouraging members of Congress to pass this bill by Veterans Day, put it on the president's desk so he can sign this historic bill to save veterans' lives on Veterans Day. And you can go to veteranaction.org, click on the Take Action button. You can contact your lawmakers. You can email them, call them, and post at them on social media, all under 5 minutes. Our Veteran Action platform makes it very easy to do that. So, Tom, I want to thank you for being a community care provider. You are really boots on the ground. You're on the front lines helping veterans in their times of desperate need. And we're going to work with the White House to get this bill done. So thank you for joining us on the Veteran Action Update Brief.
Thanks so much, Mark. Appreciate you having me.